I'm Jamie Perkins, and I'm going to talk about nodular melanoma. Nodular melanoma is described as being a lesion that is blueberry-like in nature. The surface of the skin is smooth. The coloration is pink-gray or black. It's elevated, seen mostly on the torso and the extremities. Nodular melanoma is known to have a poor prognosis because of the invasion of the subjacent dermis. The growth of the nodular melanoma is said to be vertical. Lentigo malignant melanoma appears as a flat macule. The coloration is tan. Changes in color and size, which indicate malignancy. It's slow growing, appears on the sun-exposed skin, and it occurs in the middle-aged population. Acrolentigenous melanoma. This is the least common type of melanoma. It appears as a macule with irregular borders. The macule develops into nodules. It may be characterized as invasive in the early stages. It may be seen in the palms of the hands, the soles of the feet, and the nail beds. It's rarely seen on the mucous membranes and occurs most frequently in African Americans and Asians. There's an example of malignant melanoma. The specific risk factors for malignant melanoma are fair skin, increasing mortality rate for men, a history of sunburns, excessive UV light exposure, living closer to the equator or at higher elevation because there's more exposure to UV sunlight, having many moles or having unusual moles, having larger moles that are irregular and have a mixture of colors is known as dysplastic nevi. Another risk factor is a family history of melanoma and a weakened immune system. Diagnosis and management. Excision of the lesion for biopsy is used for diagnosis. The specimen excised from the skin is sent to a pathologist for analysis. If the lesion is 1 to 4 millimeters or an ulceration is present, lymph node biopsy is included. If re-excision is necessary, the margins are required. Systemic chemotherapy is a treatment for malignant melanoma because of metastasis. Bone marrow transplant is also a treatment used for malignant melanoma. More treatments of malignant melanoma. They use surgery to remove the tumor and the surrounding lymph nodes. Chemotherapy is also used. This is it's cancer fighting and is used to destroy cancer cells. Chemotherapy can be administered intravenously or in a pill form. Oftentimes, patients may receive both therapies depending on the stage of cancer. Radiation therapy is also used to kill the cancer cells, and it's also used after surgery. Biological therapy, this is a type of therapy used to boost the immune system to help the body fight the invading cancer cells. These treatments are made of substances produced by the body or similar substances and are produced in a laboratory. Side effects of these products include flu-like symptoms, chills, fatigue, fever, headache, and muscle aches. Examples of biological therapies used to treat malignant melanoma include interferon, interleukin-2, Yervoy, Opdivo, and Keytruda. Targeted therapy uses medications designed to target specific vulnerabilities in the cancer cells. Side effects of targeted therapies include skin problems, fever, chills, and dehydration. Examples of targeted therapies include Zelboraf, Tafinlar, and Mekinist. These are drugs used to treat advanced melanoma. These drugs are only used if the cancer cells have a specific genetic mutation. Biopsy reports. A totally benign lesion requires no further treatment and is most likely a normal mole. An atypical mole may need more meticulous removal, and the doctor may remove more skin around the mole to test for malignancy. Thin melanomas require more in-depth surgery to remove deeper layers of the skin for biopsy. Thick melanomas require extensive surgery and extra tests because lymph node removal will be included. The gold standard for a conclusive diagnosis of skin cancer in general, is skin biopsy. Stages of malignant melanoma. After diagnosis of malignant melanoma, staging of the cancer is the next step. Determining The thickness of the melanoma is performed by examining the melanoma under a microscope and measuring it with a micrometer. Thickness of the melanoma helps the doctor decide the treatment plan. The rule of thumb, the thicker the melanoma, the more serious the disease. Sentinel node biopsy determines whether or not the melanoma has spread to nearby lymph nodes. Dye is injected into the location of the removed melanoma. When the dye flows to the nearby lymph nodes, the nodes are removed and tested for cancer cells. If the nodes are not cancerous, it is possible the melanoma has not spread to the lymph system. This test is not 100% conclusive that the cancer has not metastasized, but it gives a good indication that it is localized. Melanoma is staged using the Roman numerals 1 through 4. Stage 1 malignant melanoma is small and has a successful treatment rate. By stage 4, the cancer is spread to the other organs of the body. Malignant melanoma is known to spread to the liver and the lungs. Prognosis. The prognosis, or the chance of recovery, and the treatment options for malignant melanoma depend on the following: the thickness of the tumor and where it is located on the body, how quickly the cancer cells are dividing, bleeding or ulceration of the tumor, lymph node involvement, the number of affected areas of the body from metastasis, the level of lactate dehydrogenase in the blood, or LDH, mutations in the gene BRAF, and the patient's age and overall health. Thin lesions that are detected early have a 5-year survival rate of 95%. These lesions are typically less than 1 millimeter in size. Thin lesions are seen primarily with malignant melanoma. Lesions that measure 1.01 to 2 millimeters have a 10-year survival rate of 89%. Lesions greater than 4 millimeters have a 10-year survival rate at 32%. Early detection and treatment is essential to a positive prognosis. The nursing assessment for skin cancers. It's important to determine the type of skin of the patient. Some questions to ask are: does the patient have a fair or darker complexion? Does the patient have any areas on their skin that are of concern? And are there new lesions present on the skin? You should also ask, what is the coloration of the patient? Does the patient sunbathe or have sunburns? And have there been any changes in existing moles? And are there any pain or tender areas on the skin? You should also examine the entire body for abnormal lesions and moles. Don't forget to include the genitals, the folds of the skin, the soles of the feet, and the palms of the hands. If there are any suspicions about a lesion or a mole, use the ABCDE method to assess the lesion or the mole.